Welcome, Gold Delegates. I'm Fleur Bickford, Program Director and MC for Gold Perinatal Online Conference 2015. And I'm here today chatting with Kerkhoff Gromada, who is telling us a little bit about her upcoming presentation titled Breastfeeding Multiples, Learning the Dance of Breastfeeding and Lactation with 2, 3, or more Newborn Partners. So Karen, thank you so much for taking this time to chat with us today. And we're just going to jump straight into the first question, which is, I'd love for you to just tell us a little bit more about your professional journey as an IBCLC and how you got into the world of helping moms with breastfeeding.
Well, I got into the world of helping moms with breastfeeding when I started going to La Leche League meetings with my first baby. I had learned about La Leche League in nursing school and remembered it when I was pregnant. So I started to go to meetings and eventually became a leader right around the time my second one was born, or maybe a little after that. And then our twins were third and fourth, and I quickly realized that this was very different than nursing a singleton. And I requested permission to start a La Leche League group just for mothers of multiples. And I had to go through quite a process with La Leche League International to justify the reason for doing so. And that group started in September 1977, and it continues today. And I'm still one of the co-leaders. And all of the leaders of that group have breastfed twins or triplets. And from there, I'm also a registered nurse. And I went back to school in 1985 and got my bachelor's degree by 90. I just went slowly because I had 5 children at that point. And I knew that I wanted to work with breastfeeding moms, so I began studying, and I took the IBCLC exam in 1991. And so I've recertified every 5 years since then. I have done private practice. I have done hospital-based lactation consulting. I have done teaching. I've done, education programs for professionals, courses. So I've kind of done the gamut, but I can honestly say I continue to learn something probably every day about breastfeeding and lactation. The more I know, the more I know I don't know. And and that's what keeps it interesting. Nobody ever knows everything. So it's really, I love it. Every time I try to wean, I end up back nursing some more. Get myself to wean.
Well, that's wonderful.
And I guess, should I mention I was president of ILCA, International Lactation Consultant Association, from 94 to 96, and I am a fellow of ILCA, and I'm very proud of that.
Absolutely. So you should be. That's wonderful. And I love the fact that the multiples group that you started with, La Leche League, is still in operation today, and you're still part of it. I think that's fantastic. I'm curious, because you've been involved for quite some time with moms of multiples. Really interesting question just popped into my mind of what kind of changes have you seen over the years, and kind of what are some of the most common myths about breastfeeding twins that exist, and has that changed over the years, or is it kind of still the same?
Well, I'd say the basics are that people still think women can't breastfeed 2 or more babies fully. A lot of health providers still tell mothers you can't do that. You'll have to supplement, blah 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 blah. And for the most part, that's not so. Mothers are still worried about having enough milk, and that's the most common thing for mothers of a singleton. So you can imagine that that's an issue for mothers of multiples. So that remains kind of the big thing. Some of the changes that I see are that we see a lot more late preterm babies than we used to, babies who are induced or delivered electively by C-section earlier than they used to be. So we used to see preemies, and then we would see closer to term spontaneous labor more than we see now. And I think that has some issues with breastfeeding initiation that we didn't see as much. On the other hand, maybe more mothers are aware and they're coming for help, and the ones from long ago just fell by the wayside. I have no way of knowing that. So I would say that I think there's less confidence sometimes than moms had, the ones who were breastfeeding back then. But again, it may be that people fell by the wayside more. There's just no way to determine that one. Um, Pump use. We don't, it, when we started the group, we didn't have all the fancy dancy pumps we have now. And so moms who were expressing for preemies would have some rental pumps, and not as nice as the ones today, or you used a hand pump or hand expressed. And now we've got these mothers who I think really become pump dependent in many ways. We have things like sleep training that we didn't have back then. We have the more rigid scheduling, but that always has been an issue with multiples. And multiple groups outside of La Leche League are always telling mothers of multiples, oh, you must get them on a schedule. And often that causes more stress than allowing babies to feed on cue, and at least initially. So we see some things that are different and some things that are the same, some things that have become more exaggerated or less exaggerated. So it does change, and some of the lingo has changed. If I hear the word term sleep regression one more time, how can a poor little baby regress when it hasn't even had time to progress? So, but that's one of my bugaboos these days. But you hear it a lot with mothers of multiple talk, a lot.
Okay, thank you for that. Interesting comment from you about seeing sort of less confidence. I find that really interesting. But mind you, I see that actually in my my own practice and my own experience with moms, and I can't really say whether it's getting worse or I'm just kind of more in tune to it now, but I do see a lot of just that lack of confidence and that lack of breastfeeding self-efficacy, even with moms of singletons. So yeah, really interesting as to, like you were saying, it's, the more questions we ask, the more we realize that, we need more research, we need more information, stuff like that. It's definitely a lifelong learning experience. It's fascinating. So tell us a little bit about what our delegates can expect from your presentation and what sort of information you're hoping that they're going to be able to take away from it and be able to apply to their own practices.
Probably the biggest thing that I hope they take away is understanding that breastfeeding multiples is far more than the mechanics of breastfeeding. In some ways, when you just get down to mechanics, breastfeeding, whether it's 1, 2, 3, you're doing it more often. The mechanics, though, stay the same. But the emotional component, the psychosocial component, is vastly different. And that's the point, and that's why I've been thinking about this concept of the dance of breastfeeding. And it so fits in because breastfeeding, learning that mutuality, that mutual movement with a partner, really hits home when you let go and breastfeed on cue and learn from your baby, and your baby learns from you. You just get so in tune with each other you don't even realize it. And that doesn't happen so much with 2, 3, 4. And we're going to discuss why that is so, and how the impact, but also the impact of prematurity and late preterm birth, because those are gigantic in the multiples community. It's unusual to see a term baby in the multiples community. So that creates different issues.
Okay. Question that just popped into mind as you were talking there, talking about the dance and getting to know your baby and stuff like that. And I'm just wondering about your own experience with your babies. I can imagine, the mothers that I see, I find often the moms really struggle, even just with one baby, the moms really struggle with, getting in tune, like when there's breastfeeding issues, there's any kind of stress, they're so focused on, I have to pump, I have to, my baby's not gaining weight, all of that kind of stuff, and they're not bonding with their baby, they're not in tune with their baby. But it must be interesting with, 2 or more, because it's the different personalities. I was amazed with my own children just how different they were as babies. So I can imagine that with twins or more, you're learning two very different dances because you've got
Exactly.
two different little people. So
Even when, well, temperament is a component of genetics, and so often you'll see identical or monozygotic twins who are in the same dance, but they're doing it at different tempo. I mean, I would say I had two that tangoed, but one's tempo was higher, more at a faster pace than the other one's was. Um, and on the other hand, you can have a mom with dizygotic, well, you can have a mom with monozygotic, but more often it's dizygotic twins, especially boy-girl twins who tend to be the most different. And you will have one who's doing a tango maybe, or the salsa, and another one who's waltzing. And yes, and the mom has to learn these dances at the same time with two different partners. And that's why toes get stepped on more, or when you think you're finally getting into the dance, if anybody changes a move, it throws both dances off. So that, and then if you've got the voices outside saying, but you must get in a schedule, you must get in a schedule. When those voices are telling moms this, then it really disrupts the dance.
I can imagine. And that is such a great visual. I love that. So thank you. And for our delegates who are listening, you will be able to hear more from Karen and learn more about all of this during her live presentation on Tuesday, October 27th at 1300 UTC. And of course, the recording of her presentation will be available for the duration of the conference.